Good evening, ladies and gentlemen, and welcome to today's presentation. My name is Dr. Uche Odunse, and we are excited to have you in our midst today. We are happy that you are here with us to discuss some important things that we all need to know amongst ourselves and our families. We are the same Dokoto Medical Group, and we've been doing our best to try to reach communities to see what we can do to help our fellow Nigerians and people all over the world. So today we have a very interesting presentation today regarding obstructive sleep apnea, which we ask you to join us to understand what happens sometimes when we snore without even knowing the implication of what is going on in our health. So we have someone very important today, all the way from Canada, that's going to give us a wonderful presentation. Is no other person that's able, Dr. Raphael Pali. He's going to help us with this presentation today. So stay tuned, and we want you to type in your questions on Facebook, and we will address them at the end. So Dr. Pali, the floor is yours. Thank you.
Thank you very much, Dr. Odunze. It's always a pleasure to be here, always a pleasure to be among people that are trying to make a change in health, especially in low-resource communities. Today's topic, we chose it basically because of that, the importance of obstructive sleep apnea. The whole idea is to get people talking, to inspire more conversation about this topic among the general population, to get more physicians thinking about it, also to get our partner facilities investing more in the management of obstructive sleep apnea. Yeah, just as you mentioned, sometimes when people don't think about the implication of what may be happening to them. And one of the things that we tend to make seem small is snoring. So today we are going to look at this and then also get to see the importance of this, of your snoring, the importance of doing something about it, at least mentioning it to your doctor. So the American Sleep Apnea Association fully agrees with me too. It says sleep apnea is a life-damaging and life-shortening disease. So most of the time, yes, we go to sleep, or somebody says, "Oh yeah, you snore too much," or something like that, passes that comment. We don't think much about it. Yeah, sometimes we just feel bad, and then not think much about it, or not think that it's something that we need to work on. And also physicians sometimes don't think about asking their patients, "Hey, how do you sleep?" Or I think a common thing in Nigeria is that people complain of weakness, and then you get the full blood count done, you get the malaria testing done, but then I don't think people really think about sleep apnea. So a couple of researchers tried to get what is the burden of sleep apnea in the world. And so we have, as of 2013, about 936 million adults between the age of 30 to 69 had mild to severe obstructive sleep apnea. And then about 425 million of the same age had moderate to severe. And somebody will say, "Yeah, this is all over the world. What is this?" But we know that when we have a patient before us, we have the patient himself, we have the patient's family. This patient has a job. This patient communicates, interacts with the community. So everything that affects this patient affects all the people that are involved in this patient's life. So also it was noticed that sleepiness, daytime sleepiness, was in 6% of men. However, it had a range of 3 to 18%, or 4% in women, but had a range of 1 to 17%. Now, what is the whole thing about this thing? Should I try to get a good sleep? Is this something that I should actually even think about? Or is it not good, not just to be awake, and be grinding, as some people say? As I have this quote here that says, should I be sleeping or staying awake to enjoy life? Because sometimes you see some memes that say, oh, if you want to make it in life or if you want to progress, you can't be sleeping 8 hours a day or things like that, which I find funny because sleep is really important, and we're going to see why now. But before then, I would like us to reflect on this. I have a couple of questions for us here. Just reflect on it and answer it for yourself. Hopefully, this will help you to enjoy better this presentation and get more involved. So how was your sleep today? I know that it's already evening in Nigeria, right? But in other parts of the world, is either they're just waking up now or it's just middle of day. How did you feel when you woke up? Did you feel rested? If you didn't feel rested, or if you felt rested, okay, what else did you feel when you woke up? Are you still sleepy when you wake up from sleep? How long does it take for you to fully be awake, to feel fully awake? Because sometimes you sleep, you wake up, but you know that I had to drag myself out of bed to be able to, just so that I would just start the day, but I would rather be in that bed. For some people, it's just for a couple of minutes. For others, it takes also the drive to work. Some people get to work and then they are still dragging. How many times do you wake up at night? I think that's a very common question with people with urinary problems. We ask them that question, how many times they have to wake up to pee at night. But sometimes people wake up various times at night because they are not sleeping well. And yeah, you feel like you need to go to the washroom, and then they go to the washroom, but they don't think about it. They actually think that the need to go to the washroom was what woke them up. So how long do you remain in bed before sleeping off? Because that's another thing to look at too. People with obstructive sleep apnea also have difficulty going to sleep, and we're going to see why. So it's interesting that of all the questions that I put in there, I didn't put anything about time. Like, do you sleep for 10 hours or do you sleep for 4 hours or something? And that's a whole point that I want to make here, that quality of sleep is very important. However, because of course it's easy to point to a number, people would rather talk about how many hours do you sleep. So the tendency is when you go to your physician's office, you just say, oh no, I sleep very well. I sleep 8 hours. Because yes, you went to bed at midnight and you woke up at 8 a.m., right? But let's see, is there another approach to this? Should we be asking other questions? So what is obstructive sleep apnea? This is caused by a blockage of your airway, usually when the tongue collapses against the soft palate at the back of the throat during sleep, and the airway is closed. So that's why it's obstructive sleep apnea. But we also have other types of apneas too. We have the central sleep apnea, where the airway is not blocked, but the brain does not signal the muscles to breathe. We also have the complex sleep apnea. So in this case, you have a combination of both the central sleep apnea and then the obstructive sleep apnea. But what is it that happens each time here? With each apnea, so apnea is the person stops breathing, or the person is not breathing properly during sleep. So the brain now wakes you up because the concentration of oxygen in your blood goes down, your brain wakes you up so that you can resume breathing again. So that is why sometimes people actually, when they wake up that way, they actually think that, oh, I need to ease myself. So then they go to the washroom. But they don't really think about the fact, oh, well, why am I waking like 6 or 7 times at night? Of course, the fact that this person maintains a low oxygen level in the blood then causes problems. So what are the effects of sleep apnea? What does it do to you? I think the daytime sleepiness is the commonest one, or I think the most noticeable thing for the client, for the patient. And sometimes this, people call it the silent killer. I know that most times we call hypertension the silent killer, right? But nobody ever talks about obstructive sleep apnea. So it is much more silent than hypertension. So daytime sleepiness, the person is driving, he's still sleepy. He's at work, using machines, he's still sleepy, or he's a builder, he's still sleepy. He's in the morning, just imagine the student comes in the morning at class, still struggling with sleep, or the physician that, or the nurse that is in the at work, still trying to wake up. Simply because, they didn't sleep well at night, even though they slept for 9 hours. So they also have problems with concentration, problems with memory. But you see, the interesting thing about sleep apnea is that people don't come to say, oh, I had problems concentrating to drive today, so I need to see the physician. So that also is one of the things that contributes to sleep apnea being the silent killer. And we have seen that it is a life-damaging and life-shortening disease. It affects memory, gives other neurocognitive challenges. Other things, high blood pressure. High blood pressure is very closely linked to obstructive sleep apnea. So yes, we know that the highest percentage of people have primary hypertension. However, this is another cause of hypertension that we should be thinking about. Chronic heart failure, atrial fibrillation, or other forms of arrhythmias, and an increased risk for cardiovascular disease. How many of us have linked sleep to obesity? Linked sleep to obesity. Because most of the time people feel, I need to be working out, I need to be exercising, I need to be moving around. But they never think about sleep. But sleep apnea is also another thing that causes obesity. So one of the effects, of course, the person is struggling to wake up, or the person is struggling to concentrate during the day. Irritability is one of the effects of sleep apnea. So this is just a picture of a boss that comes in, everybody's saying good morning and all of that, and then the person is with that face. Or we have this person that's in front of their computer trying to write the report for the morning, preparing for the, midday meeting and all of that, and they're still struggling to wake up, even though they went to sleep as early as they could. So we've seen the problems of obstructive sleep that obstructive sleep apnea can cause. We've seen that, it affects quality of life. We've seen that over 900 million people that we know have obstructive sleep apnea. And of this, each person, the interesting thing about statistics is that, it helps us to make protocol for public health. You might see a certain percentage, but we have to also remember that each person interacts with life, and each person does when it's affected with something, affects their job, affects their family, affects their community. And here, it doesn't just affect only that, but also quality of life. This person is always struggling to stay awake, struggling to concentrate, has other things, struggling with hypertension and other things. So what do we do? First, it is good that we're listening to this presentation because that is the whole idea. Increase the index of suspicion. So when you have a patient before you, high blood pressure, think of ruling out obstructive sleep apnea too. You have a patient before you, ask them how they're doing. If they are with their partner, ask them, how do they sleep? Ask them how their work is going, things like that. Increase index of suspicion. Secondly, take a good history. Ask them about snoring. However, we also need to know that snoring is not the only thing, because sometimes if you sleep alone, you never know that you snore, right? Because you don't snore when you're awake. Your partner might be somebody that sleeps very deep and they won't tell you that you snore. And then sometimes people are a little uncomfortable telling you anything. So yeah, you might be snoring as loud as anything, but nobody will say anything to you, you know? We also need to recognize the fact that some people, I've heard the story of this person that even if he's visiting family, he would rather stay in a hotel. And it's simply because, he snores, he's ashamed about it. And so the tendency that they may not volunteer that information. So you would need to ask them if they snore. And then the way we actually diagnose sleep apnea is through a sleep study. Because the target of this presentation is not for, not only for medical personnel, but also for managers of facility, other members of the public. I won't have to break down sleep study, but that is the gold standard. That is what should be done to actually diagnose somebody with sleep apnea. So we should remember, important point is that the patient usually does not bring it up. So you have to ask. And if you're not looking for something, tendency is that you might not see it. So we have to put it higher in our differentials now. We should always remember to listen to the patient's story and try to catch other things. The patient might mention how it's difficult for them to concentrate at work. It's different for them to park, or maybe when they're taking a turn while driving. These are things that may not make us think about their sleep, right? But we need to increase this index of suspicion. So, as I mentioned, the definitive study, the definitive thing to do is the sleep study. So sleep study is done either in a sleep lab, or there is the limited channel testing that you can actually take to your home and do it. And it is quite easy to do. It's something that will just take a visit, and then somebody actually shows you how to connect it in your home. And then when you go, you sleep and then bring it back. The tests are being evaluated, and then you get another consult that tells you, okay, do you have sleep apnea? If you do have sleep apnea, what's the severity level? And then a choice is made on what treatment option you have. So there are various things that can be done, like avoiding sleeping on your back. You could try to lose some weight. We've seen that, yes. There are also surgical procedures, or you can use things that like the nighttime mandibular devices that will just sort of like push your lower jaw, and that helps sometimes. But that also depends on the severity level. But I think one of the things that really inspired this presentation is the use of the positive airway pressure machines, because the use of these have shown very good result. they have actually even made that sometimes some things that the patient did not even realize was caused by their sleep apnea. They will be so surprised. Like I have heard people, there was this doctor that her husband just started the treatment and she said, it is like a miracle. I know, and then you have other clients that will tell you that, wow, I have so much clarity now. So we have two machines, the BiPAP, which is like a bi-level machine, and then the CPAP, which is a continuous positive airway pressure machine. Usually CPAP is cheaper to use. This is the picture of CPAP. And as you can see, these are devices that you can easily travel with. The people in the airports are very familiar with it, so you can actually even fly with it. And it's quite easy to use. Most of the time, I put in there a comment that it could be intimidating when you see, wow, you mean I have to sleep with this machine? Well, what we have seen is that most of the time, yes, people think about this and are anxious in the beginning. But in the first 2 weeks, first 3 weeks, people then see a lot of improvement, then see how these machines are quite comfortable to adjust, and then also how their life changes. So the irritability, the sleepiness, being able to concentrate at work gets better. So as I say, like they tell you, now I have so much clarity. So in the beginning, yeah, there might be some resistance in using it, but it is quite easy to use and very, very beneficial. So thank you very much for listening to this presentation. Thank you for your time. I hope this inspires much more conversation about this, because there are a couple of things to look at. How do we get this to resource limited areas, the challenges with electricity? How do we get facilities to do more sleep study? But I'm happy that, yes, we can start the conversation now. Thank you very much for your time once again.